Good morning. Welcome to Singapore. For those of you who aren't from Singapore, and for those of you who are, welcome to the neighborhood. I'm Paul Irving, the chairman of the Milken Institute Center for the Future of Aging. I was pleased that my colleagues in our Asia Center included as one of the great challenges and opportunities affecting Asia over the next number of years, population aging. If everyone could kind of work their way into the room quietly, I would appreciate it because we have relatively limited time. So I'm not going to introduce each one of our guests. You have their bios in your book. Mike down at the end, Angelique next to him, and Peter and Anna. We're going to go to them fairly quickly. And one of the things that we want to do is engage with you as well. So we're going to reserve about 15 minutes at the end of our session for questions and answers. The interest that all of us have is in changing the conversation about aging and in stimulating business investment, innovation, policy change, and culture change. And each one of you are very much a part of that. So if I can just quickly go to a couple slides. Can I see slide one, please? So what we know is that global life expectancy is increasing quickly, and in Asia that's particularly the case. We can go to slide three. So in slide threes, in the major economies in Asia, what you can see is between 2015 and 2050, increasing median age. And actually, we think that these numbers are quite conservative. These are based on a series of assumptions relating to increases in longevity and obviously continuing decrease in fertility. But they really discount in many ways the kinds of innovations that are happening in science that are very likely to enable much longer lives, certainly in lifespans of many of us and in the lifespans of our children and grandchildren. Now, if we could just go to the next slide is slide 5 quickly. Well, okay, so it's slide 5. So I think an important point about Asia in particular is we know that, for example, Japan is the developed economy with the oldest population in the world. Populations are aging rapidly in Korea and China and elsewhere. But some of the greatest challenges associated with aging are in emerging Asian markets. I would particularly note Thailand. We had a senior official here yesterday from Thailand who said that this is something that is very much on their radar scheme as they think about their own pension scheme and the challenges of public health. And if we can just go to the next slide, slide 6, this just gives you kind of a global sense of the magnitude of change. So when people think about old economies, they think about Europe in particular, Russia, negative population growth, Italy, an extraordinarily old population, Germany, and the like. But what you can see is that the rate of increase in these economies is actually relatively slow, and where you see this kind of massive age shift is in Asia, and obviously in many ways the most important part of the world, the most important new economy in the world, and much of that again in smaller countries. Cambodia's numbers relatively astounding. So a lot of people talk about the challenges associated with aging, particularly dependency ratios and the risks of financial insecurity, the costs of health, and all the rest. And I don't want to ignore any of that or give it short shrift, so I'm going to ask each one of the members of our panel to comment. But our focus today is really on positive solutions. So where we're going to spend most of our time today is talking about how to address these challenges, what all of us can do in business and philanthropy and in the policy sector to change the dynamics. For those of you who remember American poets, there's a famous poet named Robert Frost who wrote a famous poem about two roads diverged in a yellow wood, and we're really kind of at that point now, very much like we are with climate change. And I think that population aging is the other great challenge to impact humanity in this century. We will either continue down the road we're going. And in that case, as Anna from S&P will tell you, we run very, very significant risks. Or what we'll do is we'll shift behavior in health, in finance, in policy, and we can have a very, very bright and exciting future. So let me start down on the end with my friend Mike Hoden. Mike, before we get to what I know you believe is this extraordinary opportunity associated with aging, why don't you just give us kind of an overarching sense of where we are, and maybe a minute or so about what you see as the great challenges that we need to address.
Great. Well, thank you, and pleased that we're here and addressing this. For those of you who attended the opening session, which I did, I'm assuming most here did, there was a wonderful video that our McKinsey colleague opened up with, where he was basically talking about resetting intuitions. And I was actually surprised, or maybe I shouldn't have been surprised, that in his video collage, he did not have something about this demographic shift. The framing that I think we should ask him to add is that what if our 60 plus, 55, 60, it doesn't really matter, but what if our 60 plus demographic is a driver of economic growth? I mean, that's, I think, at least as disruptive as a number of the other conventional wisdom points that wonderful opening video framed. And so maybe let's go to slide, I think it's 25. The way Milken does this, we're forced to actually remember which slides they are in a grouping. So this is a way to kind of reset our thinking about this, and also to give us a little bit of space in the fact that this is new. It's huge and it's new. It's global. You see it out here. But we have reached this stage which for the history of humanity has been something we've always sought but unimaginable, and now it's becoming the norm. A young girl born in the 1990s in many of our developed country urban environments is likely to see 3 centuries. 100-year lives are going to become the norm. And so what does that do to change how we live and behave individually? And what does it do to change also public policy? So let me give you, a couple sort of background thoughts based on this really profound shift. One is that we're talking about basically 2 intersecting trends. You know it very well here in Asia, which are, one presumes, separable, but equally impact on this topic of demographic change. One is that we're living longer. The second, though, are these low birth rates. And it is actually the low birth rates that are having the bigger effect on the proportion of old to young in society. So go to, I think it's the next slide, 26. There are 1 billion of us on the population, on the planet over 60. I mean, it's a huge market opportunity, which we will talk about. But it's also a great challenge. Largely, I would suggest, because of this phenomenon of the low birth rates. The real issue, therefore, is a public policy one. And that is that our institutions of society, whether we're talking about the United States, Western Europe, Japan, here in Singapore, China, are still stuck in 20th century norms. The problem is not longevity or even the aging of society. The problem is that we're somehow stuck with institutions of the last century around healthcare, around pension, around education, even tax policy, which make a misalignment between this proportion of old to young in society on the one hand and not only fiscal sustainability, but economic growth. Go to, I think it's slide 28. we were talking as we were coming up here in the elevator that we're not sure where this number came from and how accurate it is, and our assumptions that it's probably underreported. But it's a reasonable number that we're using, and it's both the context of consumer spend and spend on consumers. So in America, we have a data point which I'm absolutely convinced is as true, certainly across the developed world, including out here, that 70% of America's disposable income is held by people 60 and over. This is sort of one of the inputs to this $15 trillion number.
And Mike, if I can just comment, I know that the second point is an Oxford economics number, which actually is, this was actually commissioned by AARP in the United States, and it's products, services, and related economic activity for people 50 plus, but still an astronomical number. Again, in the United States, this would be the third largest economy in the world after the U.S. and China. So, scratching the surface.
So just to sort of wind down the opening, let's go to slide 29, which are those global corporations, some in the room here, and at least one, Nestle Skin Health, you will hear from Peter, who have recognized the opportunity and think that coming together both to advocate for change, but also to understand how to make more money on the basis of the billion that are over 60, innovation. And go to the next one, I think it's slide 30. And in fact, we had a session, Paul, sponsored by Milken a couple months ago where this topic was discussed. And it's, can we have a new kind of spirit of understanding of what an age-friendly workplace looks like? An age-friendly workplace that has flexibility around work and what we used to call retirement, that can help power and drive this $15 trillion economy and maybe even move it, to double it. So we think that this is a huge and profound change, but one which has great opportunity. And the biggest challenge, I would say, is that we continue to have institutions of the 20th century embedded in a context of 21st century demography, and it's misaligned, it's not working. So the changes that are required across society, markets will have some impact on it, but government has a very substantial role.
So I want to shift to Anna next, just to deal with this question of stakes. And by the way, a billion in 2020, Mike, but as you know, 2.1 billion, again, relatively conservative estimates by mid-century. So China will have more people over 60 than the population of the United States. We will very likely by mid-century have more people over 60 than children and teenagers.
Yeah, and the reason I stick with the billion and don't talk so much about the 2 billion is that I'm not sure I know any company who has a planning process that lasts about 30 years.
But it's certainly relevant, for all of us who follow quarterly analyst estimates. It's relevant for our countries. It's relevant for our children, and certainly very much longer term relevant for our families. So it's funny, when I think of Anna, I think of who's the disciplinarian in the room. So I guess, Anna, what happens if we don't change? So Anna, as you all know, is one of the senior analysts at S&P. So she's looking at this, I suppose, both with glass half full, but also very much half empty. What are the stakes, and what do we need to do to keep you happier?
So if we could go to slide 23. I actually don't see our job as being necessarily the disciplinarian, but definitely the work that we've done around the global aging is more of a scene setter. And certainly we've seen over the three reports that we've done since 2010, I think was the first one, we've actually seen some improvements across the board in countries and sovereigns I guess, recognition that there is a problem here and that they need to do something about it. Obviously, there's still a long way to go, and certainly what our 2016 report actually talks about is the fact that if we don't make some changes, and as Mike talked about, if we do stay stuck in the 20th century, we are actually going to see some significant ratings downgrades over the next sort of 50 years or so. And if you have a look at this slide here, what we're actually forecasting, if from today there are no more improvements, is that we would see an increase of speculative grade ratings, which is sort of BB and below. It would increase from 10% up to 25%. So that's assuming a no change scenario. And what would actually be driving that is the fact that the budgets would remain unbalanced. Governments would actually need to borrow more, and what's even fueling it is not only is debt growing, it's the interest burden that goes along with that debt that would actually weigh further on the ratings. So I think the other thing I just wanted to note is the fact that there are different issues in different sovereigns. So with the emerging economies, they have different issues compared to what we're actually seeing in advanced economies. So the emerging economies have a younger population, it is ageing, they've got growth prospects, but they've also got increasing expectations that they need to manage, and they need to work with their communities so that they don't sort of end up in the same position as the advanced economies where they have to wind back a whole lot of unfunded programs. And they need to sort of look at how they actually manage their healthcare costs going forward. So I think it's important to see this. This is definitely not our base case scenario. It is our essentially our if there is no change. This is what we're looking at over the next 50 years.
So significant risk to countries. Peter, I'm going to hold you until last, and maybe use you as the pivot point to happier things. But before we do that, Angelique, so you're a sociologist, and you study the reality of aging in communities. Obviously, you're Malay by background, U.S. trained, right, and obviously conversant with developments in Singapore. So what's the reality of the challenge of aging right now? We know that we have this increasingly large population. People are living longer. Their health span, the time that they remain healthy, is not necessarily related to, coextensive with their lifespan. What do you see as the key challenges in community?
Okay, thanks, Paul. Well, 20 years ago, when I first started research on aging, I have to say that there was hardly any interest, particularly in the Singapore context. And now, everyone wants to know about older people and their families. So as a sociologist, I focus most of my time on understanding what people want. And being in this room full of business people, I think people will buy what they want and what they need. So I was going to go through a list of things that I think are very important in today's aging society, not just in Singapore, but in a lot of developed Asian countries. And these are things that, as a researcher and with fellow researchers, we're worried about in the aging population. So the first thing is really whether older adults will be able to finance their health care. And I think that is a huge issue. We have been looking very closely at health expectancy over the life course, whether or not there's going to be an expansion of morbidity, so living longer but more years in poor health, or a compression of morbidity. And what the data shows right now, if you look at countries like Japan, we're looking at an expansion of morbidity over time. So although we're trying to improve healthy life years, we're not doing a very good job yet. And maybe Peter can talk about enhancing well-being later on. So healthcare financing is a big issue. If I could have slide number 20. This is a slide that you've probably all seen in multiple ways. It's a decreasing number of young people supporting an aged person. It brings up issues about work and retirement, and honestly, we're really scratching the surface in terms of what we know about how long older people want to continue working. We know that it's good for them, but in terms of whether they're interested, the data isn't conclusive yet. The thing that I wanted to bring into the conversation was not just the focus on older people and their needs, but also the needs of family members. And what this slide shows is the decrease in number of caregivers available to older adults. And I think that's going to be a huge issue in the next decade or 15 years hence. And we need to think about solutions for caregiving, and that can involve business solutions, technology solutions. What people want is to age in place, and so assisted living solutions as well. Singapore has been very proactive in terms of testing out new community models, ways of providing services. And the key areas we've been looking at is dementia care and dementia-friendly communities. So ways in which to integrate people living with dementia into their living spaces. We're worried about dementia because the numbers are going to quadruple by 2030. And it's going to be a reality in terms of the aging population. The last two things that I'd like to bring up that people don't often talk about, but it's becoming a new chronic disease, is social isolation of older adults. And I really hope this is where businesses and technology can come in as well. We're seeing an ever-increasing number of older adults who live alone, or older adults who live with children, but the children are too busy in the Asian context to actually spend time with them. They are at much higher risk of dying, mortality. They're at much higher risk of having physical health issues, and it all boils down to social isolation and loneliness. And my last point is, I think we really need to work on building intergenerational relationships, because all the data shows that if there are intergenerational relationships, conversations within families, older adults do better and are more productive.
So this was kind of the ultimate survey course on risk. So financial insecurity, the cost of the challenges of pensions and of readiness for at least traditional retirement, or how that retirement may shift. Health challenges, the challenges of prevention, treatment, caregiving, et cetera. So it could be painted as a pretty gloomy picture. But now I want to do a complete shift, and I want you to think about this inevitable demographic change in a very new way. And I want to start with Peter. So Peter, you know, I'm an American kid. I grew up, and I always thought of Nestle as a company that sold sugar and chocolate. I remember Nestle's Quick and Nestle's Crunch, and all of a sudden Nestle decides to convert to become a global health company. So what in the world motivated that?
Well, Paul, thank you. It's a pleasure to be here in Singapore. Singapore is where Nestle headquarters its Asia Pacific operations, and it's also an area where we do a lot of research with A-Star. So it's an important place for us, and it's wonderful to be on the stage with everybody. We look at this opportunity, this paradigm shift that's happening in the world, and we see it very opportunistically and in a positive way. And it's true. For 150 years, this is our 150th year at Nestle as a company, we were mainly focused on a phrase or that you would say is good food, good life, but we're moving our company now to be more of a nutrition, health, and wellness company. And I'd like to talk about that because it's directly related to the things that we've been talking about this morning. The first thing that you need to recognize, and I think the speakers have highlighted this, is that the current system is simply unsustainable. Healthcare costs will go through the roof, and people will suffer if we don't do things differently than we're doing them today. And if you look at healthcare budgets today, most of the money that gets spent on sick care. And we at Nestle think that it's much more productive if instead of waiting for people to get sick, we engage with the community and try and do things that sustain good health, protecting health, nurturing health, and even enhancing good health. And then when health becomes compromised, be there to do good things for them. So at Nestle, we're doing some interesting things in the nutrition side, but also in the skin health side, which is a newer area for me. And my job is to think about strategy for skin health and how we can better serve the market needs. We see this demographic as almost having unlimited potential. And the reason is in a situation where you are trying to do things to help extend people's lives and add life to their years, I think we've all benefited from this dividend of medical intervention and medical discoveries, and we're having longer lives than ever before, as we've all seen in the slides so far. What we're trying to do is figure out how we put more life into the more years that we have now. And the way we're doing that is looking differently at this segment and realizing that there are products that people need in order to achieve a better life, better outcomes. Aging in place is a really important issue for seniors. So how can we help people age in place more successfully? What kind of help do we need to give them? And then what kind of products can we develop that helps them do the things that they're trying to do and improve their quality of life? The best meetings that we have are meetings with health ministers and finance ministers, because the health ministers get it. They say, yeah, that's right. You know, if we do good things for seniors, if we give them the right kinds of support and services and products, then they're going to do better. And if they do better, they'll have better quality of lives, and hopefully they'll remain independent for as long as they can until that moment comes when life ends and the crescendo stops. But if the best meetings are the finance ministers, because the finance ministers are all looking at this and saying, oh my gosh, what am I going to do? How can we afford this? And if I'm not sure if they have that adage here in Singapore, but certainly in the United States, Paul, they have the adage of, you know, a pound of cure, an ounce of cure is worth a pound of, upside down, an ounce of prevention is worth a pound of cure. And this is really where the finance minister gets it, because if we spend money to try and keep people healthy, and if we do things proactively, if they're at risk for certain issues, if we monitor those issues more closely and then bring them help and services and products that help them maintain good life and maintain their independence, the costs are going to be completely different than if we wait for them to get sick and then they wind up in the emergency room of the hospital with the exploding costs that we're likely to see in that setting. So we look at this very opportunistically as a market, a very big market, as Mike showed, a very big market where we can impact people's lives positively by bringing them products and services that extend their life, that increase their functional abilities, and allow them to age in place and have a more successful wellness and a richer life.
Mike, you look like you want to jump in.
Yeah, so I guess maybe I'd ask Peter to connect the dots with one of the insights that Angelique was mentioning, namely this issue around isolation and the impact of isolation on physical health, which then has impact on cost. Perhaps to explain a little, okay, so does skin health have a role there, and how does changing the marketplace interact in a way that maybe 10 years ago no one even contemplated?
Yeah, so where does skin come into all these things, I guess? And at a 150-year-old company, it can be very difficult to try and get people to think about things in new ways. And I like to think that we can be a company as storied as Nestle, but still be innovative and thinking about new ways of growing the business. And I do think that in the areas of skin, there's some really important issues for older people. And I'll give you some that are fairly intuitive, and I'll leave you with one that's very touching, at least to me. Older people have skin that changes. As we all know, when we're born, our skin is very resilient. But as we age, our skin becomes more fragile. It becomes thinner, more febrile, and more susceptible to injuries and changes. There's insults, there's genetics, there's the environment that have come to play. And as a consequence, your skin is a different thing, and it protects your body. It's the biggest organ in your body. And for an older person, oftentimes they have itching and dryness. And that itching and dryness seems to be maybe bothersome right now. But in fact, what happens with itching and dryness is you can actually leave your skin susceptible to infection. And if you're going into the hospital on a routine basis, or hopefully not routinely, but on a periodic basis, and you have open wounds on your skin from scratching, well, then you're susceptible to hospital-acquired infections, and we all know that the negative consequences of hospital-acquired infections. So if we can help people to understand how to better take care of their skin on a daily basis, we can prevent those kinds of hospital-acquired infections from happening. We know that works. We've done clinical studies in hospitals where we've taken cohorts of patients and we've done these kinds of things. We have data that shows that if you actually treat people correctly and you give them a way of taking care of their skin and also an awareness for the importance of doing these things, you can have a positive outcome on what's happening with them. And that's very important. Another important area is the issue of falls prevention. In our company, we just didn't understand this. We're a company, at least the skin part of our company, we think about skin through the eyes of a dermatologist. Well, most people don't go see dermatologists. One thing we all have in this room is skin. You know, we may not have heart attacks, we may not have different kinds of issues, but we're all going to have issues with our skin. It starts aging from the day we're born. And if we're going to have 100-year plus lifespans, we really have to think about what we're going to do differently in our life to give us the fullest life we can. And what we had to do at our company is learn how to talk about the issues that we can address, but through the eyes of an aging community, gerontologists and geriatricians, or nurses, or caregivers. And what they think about are things like falls prevention. Falls prevention is a big issue in the aging. And it was interesting. I mean, when I first got involved in this area, I was sitting next to somebody whose life work was Alzheimer's disease. And Alzheimer's is an insidious disease. It does things not only for the patient or the person, but for their caregivers, for their families, for the community. It's very, very difficult. And I was sitting here thinking about skin and Alzheimer's disease and said, geez, how am I even going to sit at this table? But what I've learned, and I've learned through a lot of meetings that I've had with Mike and others, is that issues that we can address have meaning for the elderly, but we have to learn how to talk about them through the ways that the elderly think about it. And when I talk about taking care of feet, at our company, in a dermatologist perspective, we might talk about onychomycosis or diabetic foot ulcers. And that doesn't resonate very well in the aging community. But if you talk about falls prevention, they get it. And it turns out that feet are very sensitive. And if you want somebody to be stable, you need to make sure that their feet are doing well. And if you have different kinds of wounds on your feet, or if you have toenails that are infected and painful, older people will be off balance, and if they're off balance, they're susceptible to fall. And if they fall, not only does their physical acuity go down, but their mental acuity goes down as well, as you've talked about. That mental engagement, that engagement with society is one of the key things in maintaining wellness for elderly. So we need to think about how we can engage with the world and give them things that help them sustain themselves. We have a portfolio that we can drive into that area, but we have to understand how to take the portfolio in our products and support the outcomes that people are looking for.
So if I can just jump in. So obviously Peter's passionate about his business, but this is just one very small example of a challenge and an opportunity that applies across really every single sector. So yesterday we had a private session. We had folks from Philips and Pfizer and Sanofi and Google and various others, all of them recognizing that this presented a tremendous opportunity. So can I just see slide 18 for a second? Just to give you an example, just because I want you thinking. So things like autonomous cars will change the lives of older people forever. How many people in this room have been forced to take the keys away from their parents when their parents were no longer able to drive? I certainly have been in that situation. That is a problem that will not exist a generation from now because of the advent of autonomous cars. What we know is this question about isolation can be addressed through creative technology, so social networks. What we know is the sharing economy. Uber in the United States and its counterpart in China present the opportunity again for transit options. So the point is, and I think Nestle in a sense is a good proxy for this, but it's just one example, is the massive opportunity again, as Mike says, 1 billion people today, conservatively more than 2 billion people by mid-century. We think actually the numbers will probably be a lot larger than that. Opportunity occurs at the intersection demonstrably of demographic change and innovation, and there is no greater opportunity in the world for companies and for investors than in this space. By the way, I'll also say remarkably, Mike, I see you put your hand up, but I want to call on Anna here for a second. Remarkably, there have been relatively few investment vehicles created around this phenomenon in the United States, in Asia, in Europe. There are a couple very small private equity funds in Europe. There's one almost irrelevant venture capital fund in the United States, no ETFs, no mutual funds, et cetera. Incredible. So anybody who's in the business of creating capital markets products, and by the way, look at where the growth is in health financial services, technology, addressing this market. Why haven't those financial products been created? Why can't I, in the United States, and my counterparts in Asia and elsewhere, in our 401ks, IRAs, and in investment vehicles that exist in this region, elect to invest in aging screened businesses? Now that gets me to my question to Anna. So Anna, you've given us some sense of some of the things that can go wrong. What could go right? What you know, as you look at countries, you look at companies, what are those shifts that can be made that can actually change your calculus?
Yeah, so some of the things, I mean, I think the first thing, and sort of leading on from what you were talking about, governments are, you know, responsible for providing essentially the space for companies like what you've talked about, actually being able to do what they need to do. So it's almost about having a shift away from the government to the private sector, but they need to do that in a measured way. You don't want to just sort of cut things off and say, here, private sector, go forth and prosper. And we've actually seen cases of that in some of the advanced economies where it hasn't gone well, where you've actually ended up with services not being provided to people. So it does actually need to be measured. What we're looking at and what we think will make the biggest change is actually around reducing the costs of age-related spending. So that includes not just your pensions, but also your healthcare costs as well. So in some of the modelling that we've done, the biggest impact that will change the amount of debt that a government needs to carry is around curtailing some of those healthcare costs. And, you know, there's the obvious examples around, reducing the cost of pharmaceuticals, transferring things from the public sector to the private sector, and looking at the way that you actually run your health system. One of the other things that might be worthwhile looking at too is some of the perversions that you find in some of the funding, where you actually end up with services that are being provided that aren't necessary or unhelpful and don't actually sort of fix people's problems. So things like in my country, there's a big issue around a whole lot of elderly people having knee operations when it doesn't actually help solve the problem. And that's because of some of the funding mechanisms that are actually in the system. So there's lots of low-hanging fruit, and then you get into some of the more complicated structural reforms. The other thing that we also tested as part of our scenarios was around having a balanced budget and getting to that balanced budget pretty quickly. So it's one of those things, the sooner you start, the better the outcome will be. And it also is more palatable for your electorate. And in our 2016 report, there's a great line in there about the fact that voters are ageing, so you need to get started now before you actually have the medium of voters actually voting on some of these policies.
So, Anna, you're going to love this, I think. So go to slide 27. We didn't plan this. For my money, so first of all, this is when I think you now have the official name S&P Global, right, John? But this is from the 2010 report, which I think everyone should take a look at. And it's got amazing numbers, it's got analysis, it's got country by country. It's really a core document in the literature if you want to understand this space. It's been updated, as you say, I think even most recently a couple months ago. But the core insight that drives everything we're thinking about is in this statement, which I would update. So no other force is likely to shape the future of national economic health, public finances, policy making, and business strategy as the irreversible rate at which the world's population is aging. So here's how I invite you to think about it. And Paul, I think you're right that Nestle is an interesting proxy for this sort of image. You're sitting inside a strategy session for any company that we're involved with, or if you're private equity or finance world, thinking about businesses. And over the last few decades, there is barely anyone that I know who wouldn't have thought, I have to invest in China because it's 1.2 billion people, whatever the number was. Or I must invest in India because there's 1 billion people. Or how could I not go into Eastern Europe after the wall fell and we shifted the whole dynamic there with 500 million people? Or taking America, I know that there were periods of time, particularly during the 80s and 90s, where all the rage was investing in the Hispanic marketplace. Think of aging in the same way. Again, from a global point of view or country by country. And it's not that you ever would have thought that you would sell whatever product to 1.2 billion Chinese, nor would you have thought, as you were doing your business planning, that every one of those 1.2 billion are the same. But you would have thought that that's a kind of way to have a strategic screen to think about planning that would, from which innovation could follow, from which new kind of marketing would follow, from which analysis around customer and segmentation would follow. Same thing here. This is a huge opportunity. We're beginning to see that happening.
So I want to go to Angelique because let's pretend for a second that you have the opportunity to make an investment pitch to this audience. So again, you're the one who's watching what happens at ground level. What are the needs? What are the gaps? What are the opportunities? We've talked about this. So one or two ideas. If you were talking to this group as investors, what would you say are kind of the hot opportunities that they should be thinking about?
Well, in listening to yesterday and in listening to today as well, I guess one of the issues is in Asia is when you try and sell something to older people or create a market for them, it's not just the older person, but it's the family. What we're seeing more and more is that older Asians are giving money to their children. It used to be the children, you had a lot of children to support you when you're older. Now, with lower fertility rates and higher costs of living, older people are giving money to their children and helping them support them. So that's all to say that when you think about the aging customer, I think in Asia in particular, you really need to think in terms of the family context. Also take into account the needs and characteristics of the children and not just the older person alone. I don't know if that makes sense, but...
well, the only thing I would challenge you on, Angelique, is again, we need to think about this from a very practical segmentation point of view. So, you know, a 63-year-old is not an 86-year-old. Mm-hmm. But a 63-year-old or a 72-year-old is beginning to change in a sense that their skin is beginning to deteriorate. You may have different, Paul and I have a friend, Ken Dykewald, who's done a lot of work in this space. He has a firm called AgeWave. And he talks about, he's a geriatrician by background, and he talks about as we age, our skin changes, our taste buds literally change, the shape of our bodies change. So if I'm in the fashion industry, you know, I understand that there is this obsession with, you know, really well-designed 22-year-olds. But maybe you can get 10% growth for a 67-year-old. And the 67-year-old body is different from the 22-year-old body. So it takes a different kind of design.
I'm going to ask Peter just to close here quickly, and then I want to go out to the audience for some questions.
Thanks, Paul. I wanted to just resonate on what you were saying because I think it's very important. What's really exciting is living in the 21st century requires a different way of looking at things. And the family-based approach is really fundamental because it turns out that the people taking care of those older people are usually people like my age, or maybe people your age, midlife people whose parents are aging, and it's not so much the number. There could be an old 60-year-old and a very young 85-year-old. It's their functional ability. But when you're out there and you're worrying about your parents or your loved ones and trying to figure out how to make their lives better, one day you look in the mirror and you say, well, geez, what do I do to myself so I'm never like that. And what habits should I change today? What new things should I do for myself so that I have a much better outcome than my parents do? And then you look over your shoulder and say, gee, what do I do for my kids? I want them to be at a completely different zip code by the time they get to be that age. And to your point, it becomes a whole different approach for family living and family caregiving and community caregiving that's really important to incorporate in the world so that we can all benefit from the dividends that we're realizing from the healthcare advancements and not bankrupt governments and put everybody at risk in terms of ratings and other negative things that could happen to the economy if we don't do these things. At Nestle, we see it as a very big opportunity. I've talked about skin. We're doing things in nutrition that's very interesting as well. But I'm just one of the companies that's doing this, and there's a number of us that are members of the Global Coalition on Aging who are really focused on this because we see it as an opportunity that's really unmet today with almost limitless potential, and something that I hope I'll get to enjoy as I reach that point in time.
So we have this paradox of longer lives, of much greater opportunity. We know that science has done its part. Maybe social science hasn't done quite as much. We're still trying to figure out what to do with it. How can all of you take advantage of this opportunity as investors, as business people, as leaders, as influencers in your own countries and communities? Who's got a question for us? Anyone? Question in the middle. Sir, she'll bring a mic.
Thank you for your presentation. I have about 500 employees in Japan, and in my companies, its aging is rapidly growing, and then also my employees' parents are also aging. As a CEO, what can you recommend me to do for my employees to support their parents?
Well, so my guess is probably every one of us has an observation. My fast one, and we'll go down the line here. My fast observation is I'll make an observation about older workers. There's increasing evidence that older workers not only provide continuing benefit, but that intergenerational workforces actually outperform same-age workforces of any age. So companies that have figured out ways to retain and enable workers to continue in longer work lives, I think actually have a strategic competitive benefit versus those who are now forcing people out of the workforce.
So let me just,
Mike.
Sorry to jump in. Wonderful question, and we're hearing this everywhere, most places on the planet. Could you go back to slide 30, which I think we showed at one point, but the answer is follow these principles. And one of the key ones is what you alluded to, namely this elder caregiving need. We've done data in the United States, and of those surveyed, it's sort of, let's say, 52, 58, 63-year-old workers who are with parents who are older and becoming frail or are frail. 61% say that they go to work late, they leave work early, they spend time during the day trying to deal with things, and they decline opportunities for promotion. This is the secret productivity issue that's facing employers everywhere. And as Paul said, those who understand and begin to address it will win competitively, attracting and retaining good talent, but also addressing a productivity issue which is hidden behind the curtains because we still have this sort of stigma that people don't want to sort of admit it or talk about it, or oftentimes don't even know it. I go to visit my mother, I'm talking about literally me, and someone says, what'd you do? And I say, I visit my mother. I didn't say I was a caregiver, but actually I was a caregiver for that day. And it was the day that I wasn't in the office. So this is a huge issue, and there's a lot we can and we're beginning to do.
Peter had a comment.
Yeah, thank you. Japan is a very special place. We've seen the numbers. The aging in Japan is really fundamentally the first place where the whole world is encountering these things, and Nestle is innovating there. Mr. Takaoka-san, who is the CEO of Japan, is something of a celebrity because he's doing disruptive things with our business to try and better serve the needs at home and in the workplace of people as they think about how they do their daily lives. And you all know Nestle has these coffee machines, which are very popular, and they're in all offices. They're either tea or coffee. They're in all homes. At Nestle, we give those away for free. And then we enter a subscription-based program where we give people an ability to get the products that they want by subscription. And what we've done at Nestle is we've taken that machine that's now, there's millions of these things in Japan, and we've turned that into an instrument of wellness. And the way we've done that is by developing capsules of tea and putting different kinds of nutritional supplements in those tea. And you can enroll in what's called the Nestle Wellness Club and get advice on a daily basis about the food that you're eating and your nutritional requirements. And you can actually, you'll get emails telling you what kind of a capsule that you should be having today to supplement the food that you're eating so that you have a better nutritional outcome and you're maintaining the best quality of life. We're doing that in the home for seniors, and we're doing that in the workplace as well. So it's a big market, but we have to think about the way we do our things differently, and we have to leverage the resources we have to better address the needs of the market. But I think it's a really interesting place, and I love going to Japan and seeing the things that happen there.
I would just mention one other thing, and that is that we've talked about this massive market for products and services. There's a story about a woman who's become famous in the United States, Barbara Beskind. She was at the White House Conference on Aging and has been speaking around the United States. There's a famous design company in the Silicon Valley called IDEO. It's like so many things in the Silicon Valley in the United States. It's filled with lots of smart, young, Stanford-educated engineers and designers, and the average age in the company is very low. But one of the things that they wisely recognized was that this market for products and services for older people was a huge opportunity. Well, this woman, a 92-year-old engineer, reads the story about this company going into these businesses, and she picks up the phone and she calls them one day from her I think independent living facility, and she introduces herself and she says, I'm 92 years old, I'm an engineer, I was doing it before any of you were born, and she says very famously now, how can you design for us unless you design with us? So they actually hired her at 92. The theory being that if you're going to design not just cool baby carriages, but the next really cool version of a walker, you want to have a 90-year-old colleague who can work with that 25 or 30-year-old designer to say, does this thing really work? Does it make sense to me? Can I see it? Can I operate it? It's a whole new way of thinking about our company cultures. Another question, right here on the aisle.
This question is about Singapore. We all know that the physical environment in Singapore is very well planned, very carefully built. Do you know the Singapore government is doing anything to accommodate the aging trend in terms of a physical environment?
Angelique?
Yes, definitely. Let's see if I have a slide still in here. If I could have slide 22. The Singapore government just released an action plan for successful aging, and one of the key components is to develop facilities that co-locate the different generations and also provide for healthcare. So there's a few living labs around the island where they're actually trying to develop new housing models, a new way of allowing for intergenerational contact, which is extremely important. So on this slide, there's the opportunity for all ages idea, which really is about work and lifelong learning. But the kampong for all ages is where they're really trying to put a lot of energy. So again, recognizing that intergenerational relationships are important, trying to bring back that kampong spirit from the old days when Singapore was part of Malaysia, because that will boost well-being and help to offset all those ideas of social isolation and loneliness.
Singapore is one of the most advanced societies in the world on this front. Sir, third row.
Thank you. I have more of a comment and observation and a question. I'm on the board of a Chinese life insurance company called Taikang Life. And I think one of the areas that they're focusing on is health, insurance. But more than that, I think the other vertical that they have is really elderly care, okay? And I think they're trying to create insurance products that is not just for your traditional health care, but for that somebody can buy an insurance product that take care of them in old age, in terms of elderly homes.
Yeah.
So they're hoping to create an insurance product where if you buy it, over time, you can check yourself into an elderly care home, and you'll be taken care of the usual things until end of life. In fact, they even go on to arrange your cremation and cemetery and things like that. You can buy a product for that as well, right? I visited one of their homes earlier this year in the outskirts of Beijing. And the interesting thing is that, to your point, Angelique, about the family, one guy who is in his 50s checked himself in together with his mother, and they have 2 bedrooms, living across the hall, and he still goes to work, right? And then he comes back and he's staying with her, but everything is taken care of. And if you think of China with the one-child policy and ramifications of what it means in terms of the changes to the extended family, that makes a lot of sense. Thank you.
Interesting.
Your point is genius, and we're seeing this in so many places. And again, it's the marketplace changing to be aligned with this demographic opportunity. So we know that 20th century life insurance was really death insurance. And now there is a lot, as you point out, a lot of innovation taking place in that space to turn life insurance into wellness, where it has incentives and things like that. It's just a wonderful comment. Thank you.
I'd like to just add one other thing. In China, it's a fascinating place. The things that happen there, when the government decides to do something, they do it so well. And there's a big focus on taking care of seniors in China, as we know. And there's a company, I'm sure you've heard of it, Pine Tree Senior Care, which is a Chinese-based, it's a Shanghai-based company. And their business is to provide caregiver services to seniors at home so they can stay at home and age well in place. It's a company that's just exploding in terms of its growth, but it's very focused on trying to elevate the understanding how to engage and interact with seniors, what kind of products and services to deliver them, and how often they should deliver to them, what frequency and what context, so that they can have their best care. And they're doing really interesting and innovative things. They're not only training senior people or young people to go in and provide care to seniors, and very successfully, but they're using an Uber-like model, on-demand care, which is you can call up and ask for some level of care to come, or you can ask for a car to come and take you somewhere. So they're really innovative in ways of trying to figure out how to leverage the resources and the opportunities we have in front of us now, but put them together in a different way to provide products and services to seniors.
So unfortunately, we're out of time, and I know there's some more questions that I would encourage you to come up to the stage or to interact with any of our panelists afterwards. So in summary, we know that aging presents great challenges for Asia and the world, but we also know that it provides extraordinary opportunities, and I hope you'll join us, whether you're an investor or involved in real estate, technology, health, or travel, or any other industry, in thinking about new ways to take advantage of this changing demography. So please join me in thanking our guests.
Thank you.